The most common type of cancer for women is breast cancer, and older women are more likely to be afflicted by it. However, in the recent years, the rise of young women with breast cancer is worrying, as 1 in 5 women develop the disease before turning 44. All women need to know how to identify breast cancer risk, as breast cancer has an 80% chance of recovery if detected early. To begin with, breast cancer relies on the hormone estrogen to grow. 80% of breast cancer cells contain receptors for estrogen, so it needs estrogen to activate it and grow. Milk and any diet high in fat spikes up the estrogen levels in the body, increasing the risk of breast cancer. Because fats contain estrogen, it is important that your diet do not contain too much fatty foods. Women whose menstruation cycle starts very early at a young age and also those with late menopause will have the risk of developing breast cancer. This is due to the fact that these women are exposed to the estrogen stimulation for a longer period of time. Women who take contraceptive pills on a long-term basis also increase the risk of breast cancer because contraceptive pills contain high levels of estrogen. It is very common for women who are infertile to depend on the IVF method to get pregnant. They too face a huge risk for breast cancer as IVF relies on external estrogen in the conceiving process. Another cause is family history. If within your immediate family, your mom or your sisters have breast cancer, chances of you getting breast cancer is twice as high as the average person. However, many women with no family history can still get breast cancer due to the lifestyle choices they make. Studies also found that women with lower levels of melatonin, especially those who sleep late at night, have a higher risk of developing breast cancer. Alcohol is part of most cultures and different celebratory events, but it is a significant risk factor to breast cancer. Studies found that even small amount of alcohol is linked with an approximately 30% to 50% increase in breast cancer risk for healthy young women. If you are already diagnosed with breast cancer, it is best to completely avoid alcohol. This is why assessing the risk and going for yearly comprehensive breast cancer screening is so important. Now here are some steps we can take to reduce breast cancer risk. Because a good 40% of breast cancer cases are linked directly to our diet, there are some foods we need to avoid. They include leftover food, processed food, and canned foods, which contains carcinogens. Excessive consumption of canned food can cause gene mutations, leading to formation of cancer cells. Marrying early, giving birth, and breastfeeding all lower the risk of breast cancer. Giving birth and breastfeeding reduces the risk of breast cancer because it disrupts the menstrual cycle temporarily. The breast tissue cells will not get stimulated by hormonal fluctuations and estrogen for a period of time. Another way is to increase soy intake to lower breast cancer risk. Soy contains high concentration of isoflavones which attach themselves to estrogen receptors of breast cancer tissue cells, thereby blocking estrogen from coming into these receptors. Also, limit the alcohol intake as we all know, the more you drink, the higher the risk. The good news here is breast cancer is more receptive to medication in its early stage and has an 80% chance of recovery if detected early. In conclusion, it is recommended that women above 40 years old to go for a yearly mammogram and ultrasound scan for early detection of breast cancer. I hope you have enjoyed watching this video. If you have questions regarding any health matters, do leave a feedback at the comment section below. If you find this video helpful, please like and share the video. Here is another video we believe you will enjoy. For more secrets and tips on living and maintaining a healthy lifestyle, do remember to subscribe to our channel.